Hello, everyone. Welcome. Welcome, everyone. Just bear with us another 30 seconds or so, just making sure everybody is coming in from the waiting room. You may have just seen a notification. We are live streaming on Facebook as well. So if you are listening to us out there in Facebook land, you are most welcome. So thank you for joining us. Just a note for the Facebook users, we unfortunately won't be able to field any questions you may have if you enter those using Facebook. But you are welcome to enjoy this session and hear all about the cutting edge, leading edge developments in the field of health informatics. So we welcome all of you, both folks who are here in the live Zoom session. You will be able to post your questions, and also to those folks who are with us via the live Zoom. So if you just popped in to either Facebook or the Zoom room, I again would like to welcome everyone. My name is Dr. April Bolton, and I am the Dean of the Graduate School here at Hood College. And we are really excited about this event tonight. It is actually my privilege and pleasure to introduce colleague Dr. Tim Coffin, who is going to be sharing with you all some of the leading edge developments and directions in the field of health informatics. So whatever your field may be, if you come from a computing background or a healthcare background or some other background, I think you're going to find tonight's update really timely and really important. So I think you're going to be very engaged with what you're about to hear. So with no further ado, I would like to introduce our keynote speaker tonight. Dr. Tim Coffin is a veteran of the U.S. Air Force, where Dr. Coffin amassed more than 1,000 hours of operational flight testing in his 14 years of service. Thank you, Dr. Coffin, for your service. During his time in the Air Force, he contributed to research development and a number of international cooperative programs. Dr. Coffin holds board certification as an AMIA certified health informatics professional, as well as PMI certification in project management. Additionally, he holds DAWIA certifications in program management, research and development, acquisition logistics, and test and evaluation. His education includes a Bachelor of Science in Engineering from the U.S. Air Force Academy, a Master of Public Administration from the University of Dayton, and a PhD in Health Research Sciences from George Mason University. So again, several decades of experience in healthcare, health research, health informatics. We are very excited to welcome to the Zoom podium, Dr. Tim Coffin.
Thank you, April. What we're going to talk about tonight, I guess, is some updates and things about the field of health informatics. Right now, health informatics stands really at the intersection of healthcare, information technology, and data analytics. It's a multidisciplinary field dedicated to the effective management of healthcare information to improve patient care. And that's what we focus on, is making patient care better for across the board and utilizing data to do so. We're also looking at how to improve health services and looking at issues like public and population health. Health informatics involves the design and development and adoption and application of IT-based innovations in healthcare planning, delivery management, and some other areas. What health informatics is, it's defined as the integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. I like to say it's actually the Rosetta Stone of modern healthcare. What I have found in my experience is that health informaticists have the ability to communicate between the medical profession, like the doctors, the computer folks, like the the IT folks, and then also the statistician. What I found is traditionally these people have different vocabularies and have trouble.
I do apologize, Dr. Coffin, you are muted.
Yeah, we have the ability in the health informatics field to understand each one of these disciplines and work with them. Some of the key focus areas in health informatics right now are electronic health records, which are really central health informatics databases. They enable system storage and retrieval of patient care and information. We also do a lot of work with health information exchanges, which are large-scale data systems and sources that people use to post healthcare information so that we can use them across hospitals. Health informaticists are very involved currently in telemedicine and telehealth. We get involved by streamlining the remote delivery of healthcare services. We're very big at looking at data analytics and artificial intelligence to do things like clinical decision support, offering clinicians health real-time information. And then we also work with population health management and public health management. So we can go to the next slide. What I want to talk about is some of the current challenges that we're trying to address in the field. So as many know, because of COVID and also with the increase of the available healthcare in the U.S., we've developed a shortage of healthcare workers. Staffing at hospitals right now is really a top concern that hospitals are trying to deal with. At least half of practicing radiologists in the U.S. are experiencing chronic related exhaustion from workload. We expect a shortfall of 13 million nurses by 2013. And additionally, we have a backlog of routine treatments because of the pandemic where people couldn't get in. So everybody's moving to the doctor right now. So we're looking at addressing those kind of shortfalls. Next slide. We're also looking at things like social determinants of health. As many people know, healthcare, when you talk about a person's overall health, about 40% of their health is due to actually visiting a physician. The other 60% is due to things like genetics and social determinants of health like housing, food stability, exercise. So we are looking at how to help people take responsibility for their own health and trying to eliminate any barriers to health that were caused by any kind of social determinant that prevent them from living long and happy lives. Next slide. So what we are looking at is prioritizing clinician wellness. Because of this clinician burnout, doctors are working longer hours, they're seeing more people. We are used to focus on what they call the triple aim, which was cost, quality, and access. But the physicians are now looking for the quadruple aim, which is physician well-being. Because if your doctor isn't working well at their top of their game, they'll make mistakes. So we're trying to lessen the burden on the clinician by introducing technologies into the process. Next slide. Excuse me. Next slide. One of the things we are focused on is digital upskilling through continuous training. 1 in 5 healthcares left the field since the pandemic, either because they got overworked or they retired or got sick. So we have a lot of new staff coming into the field. So we have to really focus on training them up and making sure they understand new technologies. And we're looking at workflow automation, how to eliminate some of the repetitive tasks that are done by the clinicians and by the nursing staffs, so we can use technology to do that. So, but we have to make sure that people understand how to use those technologies. Next. One of the other things that you're probably starting to see a lot with things like remote monitoring of hearts or remote monitoring of diabetics is to enable remote operations and using technology to move remote guidance into the field where patients are. So, I've seen many people with little technological devices on their arms that are monitoring their blood sugar and reporting their blood sugar to their doctor, so the doctors in their office can maintain and look at how you're doing. You're seeing people that are putting in pacemakers with that can be monitored by doctors, where the real-time telemetry is sent back. With all these devices out in the field, the data streams that are being reported are significantly increased, and the health informatics field will be very instrumental in looking at these data streams and helping interpret the data for the healthcare field. Next slide. The other thing we are looking at is vendor neutral and interoperable informatics solutions. You have many electronic healthcare record systems, you have many radiological systems, you have systems to look at for cancers, you have hospital systems that are financial systems. It's going to be the job of the health informaticists to take all these variety of systems and bring them together so they can speak in a seamless form. I was meeting with one of my colleagues at a local hospital, and she told me that they had 195 different computer systems within the hospital that had to communicate with each other. It's not just the job of the CIO to bring the computers together. It's also the job of the health informatics field to make sure that the data can talk to each other and that the output is understandable. Next slide. Excuse me. We have a movement to the cloud, where we're starting to put systems on not within the hospital, but in a cloud infrastructure. And we need to make sure these are secure and they're enabled. This will also give healthcare providers the access to a bunch of disparate information that is now co-located to each other. So you're going to see the job in the health informatics, data informatics type field of bringing the data together from these variety of systems and helping them communicate to bring more understanding within the data. Next. Then we have a seamless patient monitoring within and beyond the hospital walls. And this is similar to what we were talking about using remote technologies to monitor your patients. But we're starting to do more clinical surveillance within the patients to look at them across time. We're also doing predictive analytics to look at whether caregivers will predict, trying to help caregivers predict adverse events. We want to know if people are going to fall. We want to know if diabetics are going to crash. We're trying to figure out whether things are going to happen and prevent them before they happen to make sure that patients stay healthy. Next slide. There's also a significant increase in focus on equitable and inclusive healthcare delivery. As we know, the pandemic really disproportionately impacted vulnerable people and worsened global health gaps. We need to develop data-driven strategies within hospitals and health systems to find these people and make sure they have access to high-quality healthcare. So by focusing on these healthcare disparities and looking at the root causes of them, we can prevent them and really target interventions for people. And then we can look at, things like emergent technologies such as remote high-risk pregnancy monitoring, for instance, or mobile ultrasound systems that we can, take healthcare out to the neighborhoods where they need them and provide them to, decrease the inequitable use of healthcare. Next slide. So some ways that, people in the health informatics are going to address these fields. As you've seen, a lot in the press has been on generative AI, but we're going to be using generative AI in healthcare. I recently was working in a NIH program where we were using AI to look at clinical trials information to help pull the content out of that and make it usable to people so they could find it better. But generative AI is going to be used to synthesize data and to provide it back to people in a meaningful manner. There's going to be a significant increase in the use of artificial intelligence, things like computer vision, in diagnostics, natural language processing, pattern recognition, such as looking at radiology, looking at genetics. So we'll be creating algorithms in these artificial intelligence fields, in supervised learning and unsupervised learning type scenarios to actually increase the diagnostic capability of the healthcare field. We'll be looking at remote hospitals, for instance, where you'll be able to, we have the ability to do remote surgery where a surgeon will be working on a robot in one building and across the country will actually be doing surgery on a patient. Excuse me. So, the introduction of remote healthcare and integrating technologies into the process are going to be very important, and you'll be instrumental in doing that. And then, the big part of health informatics is data-driven, looking at the data and making sure that the business models support the hospital, try and look at revenue streams, look at practice patterns, and really help overall the medical profession increase their efficiency within their structures. Next slide. So some recent projects that I've looked at that health informatics field has put forth is one is a comprehensive and standardized cardiovascular care to decrease readmissions. As many people know, that the government has a readmissions program, a 30-day readmissions program, where if someone goes into the hospital and is readmitted within 30 days, the hospital is essentially fined for not properly caring for the patient. So we're looking, this program was looking at data and looking at the patients to try and figure out what were the key indicators to see that someone was going to be readmitted. Another project we were looking at was reducing medication errors by looking at clinical decision support systems, and then alerting doctors that you've just prescribed a medicine where this medicine over there is contraindicated, so they'll cause problems, or some patient is using one where another patient will be using another, or something like, you've just measured a person in kilograms when you should have been measuring in pounds. So the actual medication you gave them is the wrong prescription. Another project was looking, as with the cardiovascular, doing the same with pulmonary disease, looking at the readmission reductions. You're seeing a lot of introduction of mixed reality, virtual reality systems for training within the healthcare field, or actually medical procedures. Helping older folks working with this types of technology to help them interface with the world. And then I've worked on a project where we were using Alexa to help people post-surgery to make sure they take their medicine, remind them to weigh themselves and report any problems. So you're seeing use of computer-assisted self-interview devices for older adults to look at outpatient center for primary care screening. In our case, we were looking at heart patients and asking them questions every, in the morning and the evening. And we had about an 80% increase in our patients following their appropriate care after their cardiac event. Next slide. So, I mean, if you're interested in the health informatics field, some of the top jobs within the field, I mean, you're talking about a chief medical information officer, or a chief information officer, chief data officer. These jobs usually are C-level jobs within an organization. They run, the pay on these jobs is anywhere from like $150,000 to $200,000, $300,000 a year. You have nursing informatics specialists, where nursing where you'll be looking at nursing patterns and looking at ways of improving the way the nursing staff functions. These folks work, make around 80 to 100,000. The informatics nurse is relatively similar to the nursing informaticist specialist, but usually more senior, and they're making up to 100,000. The director of informatics is probably working within a hospital is around 150 to 200,000. So when you look at the jobs, you got health informatics consultants, bioinformatics, clinical informatics, nursing informatics. There's also within government jobs like population informaticists and healthcare or public health informaticists. So there's quite a few opportunities out there with this type of degree that you're looking at. And these are usually very, very good paying jobs, anywhere in the $80,000 to $150,000, $200,000 range. Next slide. So, we have developed a program at Hood College, a couple of programs at Hood College to help people get into the health informatics field. What I've found is that health informatics is a very good field for people to get into that do have a healthcare background, but it's also a good field to get into if you're looking to change your career, because you're looking at IT skills, you're looking at healthcare skills, and statistical skills. But one of the biggest skills that I think is important for the health informaticist is your communication skills. So our master's degree program is a 30 to 33 credit health informatics hybrid master program that gives you highly specialized skills in data science and health information systems. You can specialize either a artificial intelligence track, machine learning, or a bioinformatics track, which will give you sort of a couple different directions to use the experience. We also have a 12 credit certificate program that if you're already in the healthcare field and you want some more specialized knowledge within health informatics, it will provide you information on how technology systems work and how to create algorithms and utilize electronic health records for data, work with clinical decision support systems, and generally look at data from a health informatics perspective. So I believe Vanessa can probably talk a little bit now about how to get involved. But one thing I wanted to leave you with is, health informatics is a multifaceted field that's really instrumental in driving innovation, efficiency, to improve outcomes in healthcare. As the technology continues to evolve in this area, so does really the landscape of health informatics. And being in this thing, you're going to be promised a future that's going to be working with patients and integrating your knowledge into data-driven healthcare services. I think really health informatics is the future of healthcare, and it's an exciting time to get into the field. I don't know if there are any questions. Let's see what we got here.
Hello, everyone. My name is Vanessa Solis, Assistant Director of Graduate Admission at Hood College. And I'm going to be reading your questions, but please feel free to enter your questions in the chat. We will be happy to address them. And Dr. Coffin, we have a question from Ms. Dora. How can artificial intelligence be safely leveraged in bioinformatics?
I'm sorry, my computer made a beeping sound. Can you repeat the question?
No worries. How can artificial intelligence be safely leveraged in bioinformatics?
Well, artificial intelligence, when you're using artificial intelligence in healthcare, it's in a very, very controlled environment. So as with when you do drug testing within the healthcare field, when you introduce AI algorithms, you're going to test them the same way that you're going to test a drug. You're going to do controlled tests, and then you're going to do open tests. When you're building algorithms for healthcare, typically within this environment, we do supervised learning, where we take a database where we know the outcomes and we test and train based on known outcomes to look at the predictions made by the system. But artificial intelligence isn't made to replace the medical community. It's made to enhance their decision making. So, you know, we're not in the area of Star Trek right now. So we still have doctors and nurses and healthcare professionals overseeing the use of these tools. So you do have the backstop of humans so far.
Thank you so much, Dr. Coffin. The next question is, I am a nurse administrator. What type of computing background or training do you need to break into this field?
Honestly, you don't need any. One of the things that we do in this program is, as I said, this is a great program for people that are looking to change the way they do things. The programming that is required in this is taught in the program. So we're talking about the use of Python, SQL. We're not talking, these are higher level languages. A lot of the systems right now in health informatics are what they call low code, no code systems, where they are, you're not having to program at all. You're just going in and setting up the algorithms and bringing the data in. So, you know, the background in computer science that you need will be taught in the program. We do have, for those people that don't have a computer science background coming into the program, we do have, that's why I say it's a 33 or 30 credit hours. We do have a one class that gets you basically an introduction to programming to give you the basic concepts you have to be successful in the program.
Thank you so much. And the next question is, if patients have records in several unconnected health systems, how can informaticists consolidate the data so it can be used?
A lot of times it depends on the accessibility of the systems. Currently we use a lot of various hospital systems are connected to health data or health information exchanges, where they have set up their information with a certain structure that can communicate with the health information exchange. And then these various systems can go out to the health information exchange and exchange data. So one of the things you learn about in the health informatics program is what these data standard and exchange standards are for moving data back and forth across various platforms. So what you have in many systems are APIs and data exchange standards that say, you know, when you know, this particular piece of information is a diagnosis, and no matter where you see it in any certain data system, this code means it's a diagnosis, and that's how you pass it back and forth. So really, it's the introduction of data exchange standards and APIs is what we're using to pass data back and forth.
Thank you so much. The next question is, are there any major differences between medical informatics, health informatics, and bioinformatics, or are they all the same?
Well, health informatics is a overarching category of informatics. Medical informatics and nursing informatics, population informatics, and bioinformatics are subsets of health informatics. So medical informatics is focused more on the clinical aspects. You know, in health informatics, we look at the clinical, we look at the business informatics, which is looking at the billing and insurance sides of the aspects. We also look at the bioinformatics side. So health informatics is the general field, where bio, health, population, excuse me, those are all subcategories of the overall health informatics field.
Thank you, Dr. Coffin. The next question is, I have a degree in geography information systems, and I did my undergraduate thesis in canned foods and hypertensive lifestyle. Due to this, I have developed more interest in health, especially using data to ensure healthy lifestyle. Am I a good candidate for the Masters in the Health Informatics program?
Actually, you're probably an excellent candidate, because the geospatial aspect of a lot of the information systems that we use are very critical. So understanding those systems, which is, one domain of doing data analysis, excuse me, would make you a very good candidate for this program by adding the domain of healthcare knowledge to your current, existing skill set. I think you'd be able to do some very good work within these within this field.
Thank
So I
you
think
so
you'd be a
much.
great candidate.
I am actually a current IT professional in a hospital, and I would like to know what kind of health knowledge I would need to switch into health informatics.
Well, I mean, I think by virtue of working in a hospital right now, the health knowledge that you have is probably a good starting point. As you move forward, we tend to work with, I am a PhD, not an MD, so I have to work very closely with medical professionals for the diagnostic aspects of what I'm doing. So, this is a corpus of knowledge that you develop over time. When I entered this field, I didn't have any of the background, so it was okay at the beginning, and through research and working with my contemporaries and through, the academic programs that I had, I learned a lot of the healthcare information corpus of knowledge to incorporate with my IT knowledge. So I came from an IT background into this area. It didn't hold me back much. I was able to develop that healthcare knowledge domain.
Thank you so much. And I encourage all our participants to please enter your questions in the chat. We will be happy to answer them. The last question I have is, can you use health informatics to address the current mental health crisis in this country, like depression and anxiety?
Well, specifically, yes. And my background and research is in depression and mental health. I'm developing several tools to help mental health professionals deal with depression. One of the tools I'm developing is an AI program that can look at the phenotypic expression of a patient and help predict which type of prescription will best perform for their situation, their demographic and phenotypic expression. So I am very involved in the mental health aspect of the health informatics field, and it's something that's near and dear to my heart. I've built models to help predict suicide risk within veterans populations, how to predict depression, how to look at depression, and how to determine the most appropriate pharmacological solution. I've also looked at systems to predict people that would have to address drug addiction. So it is a very useful tool in the mental health profession moving forward. Yes.
Thank you so much, Dr. Coffin. Thank you so much for your presentation. We really appreciate that. And I'm just going to talk about Hood College very briefly. We're very, very happy to have Dr. Tim Coffin with us, launching the new program in health informatics. Hood College is located in the heart of Frederick, Maryland. We're just 1 hour away from the U.S. capital, Washington, D.C. And we are very, very excited to launch this new program. We have a master's degree as well as a certificate in health informatics. We have part-time as well as full-time options, especially if you are working, you can definitely consider to just join the master's as a part-time student just by taking 1 or 2 classes. We also offer hybrid formats. It means that you can just log to your classes from home or just do your assignments or come to campus as well. We have different formats for you. All the classes are small, and we actually call Hood College small but mighty. You're going to have a personal interaction with your professor, and our schedule is usually the classes are offered during the evening to accommodate your working schedule. My name is Vanessa Solis. I am the Assistant Director of Graduate Admission and Liaison of the Health Informatics Program. And I'm going to stop this slide here just for 1 second, because I will really appreciate if you can please take a screenshot of this just for 1 moment. That's my email address, my phone number, as well as my WhatsApp. And with the QR code, you will be able to find more information about the program as well as the application process. So I'm just going to stop for 1 second here. Please take a screenshot of this. Again, thank you so much for attending our presentation today. We are a very inclusive university, and we would love to welcome here. International students are welcome to this program as well. We have a variety of different programs for you in the STEM field. And remember, with a STEM degree, you get up to 3 years to complete your OPT working legal in the US as an international student. Dr. Timothy Coffin, again, thank you so much for your collaboration today. It was a pleasure to be with you today. And for everyone who is listening to us from Facebook, thank you so much for your time. We will be sending you a notification, a survey about this, and we will really appreciate if you can fill it out. Welcome to Hood College. Have a good evening.